Hello and welcome to Grace Breast Cancer video series. My name is Medhavi Gupta. Today we'll be chatting about surgical management of breast cancer. I'm joined by Dr. Jessica Young. Dr. Young is an assistant professor with the Division of Surgical Oncology at Roswell Park Comprehensive Cancer Center in Buffalo, New York. She is also a member of National Comprehensive Cancer Network or NCCN Guidelines Panel for Breast Cancer. Welcome, Dr. Young. It's a pleasure to have you with us. Let's talk about what the patients can expect after the surgery is done. To begin with, can you tell us how long the patients typically stay after the procedure?
Sure. So for a lumpectomy or a lumpectomy and just a sentinel lymph node biopsy, most patients go home the same day. So the procedures range probably from about 45 minutes to about 2 or 3 hours or so for that procedure. And patients usually tolerate it very well. Most of our patients here really only take Tylenol and ibuprofen, so they're not even using many narcotics. The expected things are that, of course, you will feel swollen in both the breast and under the lymph node area if you have that area done. It doesn't mean that you're bleeding. That swelling is very natural. And most patients do very well with a nice supportive bra or undergarment and some ice packs as well. The thing that's a little bit different to note is that if we're doing the lymph nodes, often patients feel some tingling sensation underneath their arm and around the back. That's from the nerves being a little bit irritated by us pushing them around when we're trying to get out the lymph nodes that we're interested in. That usually goes away within 2 to 3 weeks. However, we always like to tell our patients that it's going to happen so that they're not too surprised by that. It does not mean that they're going to get lymphedema necessarily. These are just pretty common side effects after the initial surgery. On the day of anesthesia, I would say also that you feel pretty tired once you get home. I wouldn't plan any big events or anything. Most of the time, patients can eat or drink whatever they want to, but they do feel pretty tired after the surgery. Usually by the next day, they feel pretty good. In terms of the mastectomy, or if you have to have an axillary lymph node dissection or any type of reconstruction, most of the patients do stay with us at least overnight in the hospital. I would say most of them end up going home the next day. Usually there are drains left in place though to help control the fluids that are in the surgical sites and for better healing. Most patients are able to go home the next morning. It doesn't mean that patients are supposed to be in bed all night and they're supposed to be at bed when they're at home. This is not a bed rest situation. Even in the hospital, we encourage them to get up and go to the bathroom and walk in the hallways if they're able to. And the next day when they go home, it's the same thing. They should be able to get up and walk around and still be pretty active. Really, we ask you not to usually do any heavy lifting or to do too many repetitive motions, certainly no driving. And that's usually until the drains are out and you're better healed. But patients tolerate it very well. They can take narcotics for it. Sometimes they don't, sometimes they do.
So as you mentioned, a little bit of pain and swelling in the area is expected after the procedure. Could you also talk about what are some of the complications that can happen after the surgery and what are some of the things that patients should watch out for in order to recognize them?
Absolutely. I think there are really just two major things that we worry about after surgery, and that's really going to be infection and bleeding. So you are going to have a natural swelling. The body makes a fluid that fills up the space with a fluid that we call seroma. Seroma is not bloody. It's not blood, but it can be bloody. But it's very watery. And sometimes I will tell patients that if they can hear a little bit of fluid, if they're walking around and they hear a little bit of fluid in their breast, almost like it's a water jug or a water bottle with water in it, that can be very normal and that's okay. If you're bleeding, obviously, usually this presents within the first few hours after surgery, and that can be a lot of bruising in the skin. And then really what we would expect is that there's an expanding amount of fluid under the breast, and it will continue to expand to the point where it's very uncomfortable, as opposed to the seroma usually expands, but it's not super uncomfortable and it usually stops on its own. So obviously, if you're bleeding, you should let the surgeon know. That's very important. When we're talking about infection, you want to look for redness around the area of the incisions. Usually we call it blanching redness. So if you press on the redness and you see it go white and then you take your fingers off and it turns red, that may be an indication also of infection. You may also have fevers or chills, or sometimes we can see actual drainage that might be looking a little bit infected like pus. That's not going to be as common. Mostly it's a skin infection that we're really looking for. So obviously, if a patient has any issues with that, they can call their doctor, and usually, hopefully, an oral course of antibiotics will help to take care of it. In worst case scenarios, we may have to take you back to the operating room. Certainly for bleeding, we often take you back to the operating room. But for infection, hopefully we usually don't have to take you back to the operating room for that, except in the worst case scenarios.
So let us say a patient does not have any complications from the procedure. When can they typically resume their normal activities?
Well, really, we encourage you, if you are just doing a lumpectomy only, really, you can resume your normal activities the next day. Obviously, you will be a little bit tender in the area, but as long as you feel comfortable doing an activity, you can drive a car, you can lift weights. I once had a patient run a 5K race the next day. I don't know if that's super comfortable, but it was not an issue for us in for healing. If you have a mastectomy, or if you have lymph nodes having been taken out, usually we ask you to wait at least 2 weeks before you do any driving or heavy lifting. That being said, you could still, as I mentioned, get up, walk around your house. You can eat normally, bathe normally, certainly type on the computer, text on your phone. So a lot of your normal activities are okay. We would just ask you to refrain from very heavy lifting, driving, or doing really repetitive motions. Like, for example, I have patients that sometimes are big knitters, and that involves a lot of actually repetitive motions in the arm. We ask you not to do that.
Are there any long-term complications that could happen with breast cancer surgeries?
I think there are certainly changes to the breast that can happen. So obviously with the mastectomy, there's a much more dramatic change to the breast, including the reconstruction. Again, you could have the lymphedema issue, or you can have chronic scarring underneath the arm that may cause you to have range of motion issues, although that does not tend to be too common. After a lumpectomy, the breast may become a little bit smaller with the radiation and have changes to the skin that are a little bit thicker. I wouldn't call that a complication per se, but it's a known effect of the radiation treatment. In terms of, I guess, pain would really be one of the bigger long-term issues that you can have. The pain does not tend to be super significant with a lumpectomy, although I do have patients that will state that they have very short stabbing pains every month or so. They'll feel something that just is very quick there. There's not a lot we can do with that, actually. The pains are so quick that there's not a medication they can take or anything, but it doesn't tend to bother patients too much. When we think about mastectomies, whether you do reconstruction or not, it is important to note that the entire chest wall tends to feel very numb. And so that's an important thing just to think about when you think about whether you want to do that or not. There are also what we call post-mastectomy pain syndromes, where people have chronic pain all along their chest wall. That is not super common. When that happens, we tend to refer you to pain service for different injections or other things that can help with the pain.
Well, thank you, Dr. Young, for being with us today and sharing your knowledge with us. We hope
you're welcome.
we are able to help our patients.
My pleasure, anytime.